Labvakar, tere ochtus, labas vakaras. And here my knowledge of Latvian and Estonian language already expired. So good evening, dear webinar participants. I'm so happy to welcome you to our first Baltic webinar, laser treatment and complementary Dermo cosmetic application in fields of hyperpigmentation, rosacea and regeneration. I'm very proud to have together with us great speakers and known experts in their fields who will share with us their expertise and practical scientific part. We are planning to start with our special guest from United Kingdom, Dr. Firas El-Naimi, with his presentation, Dermo Cosmetic Care Complementary to Laser Treatment. Second part will run with Baltic experts, known speakers from Lithuania, dear Dr. Rūta Gancevičienė, and she will present skin regeneration local study. From Latvia, great speaker Dr. Anna Berzina, who will introduce hyperpigmentation local case, and amazing expert from Estonia, Dr. Kaisa Viljar, who will as well present melasma local study. Short reminder, on your desktop on the right, you'll find column with question and answers. So please be brave and address your questions to our speakers. Our webinar duration must take place about 2 hours. So please, once again, big thanks to you all to connect. I know that you are fully booked with different kinds of webinars online, but it's very big pleasure and we are very happy to see you all together with us. So let's have time together and celebrate science. Let's start. Let me introduce our special guest, great expert, and in my opinion, charismatic dermatologist, Dr. Firas El-Naimi, UK board certificate consultant dermatologist who is also fellowship trained in Moxon lasers, works in central London, and is also affiliated in the University of Aalborg in Denmark, where he is involved in research. Has authored 180 scientific articles and spoke in 55 countries, huge, around the world. In 2019, won the Global Excellence Award for the title of the best dermatologist in London. So, please welcome dear Dr. Firas El-Naimi.
Okay, so good evening, and thank you very much for the kind introduction. First of all, I'd like to thank Beiersdorf and Eucerin and Sandra in particular, who manages this part of the continent. So this is who I am. My name is Firas El-Naimi. I am based in London, and I'm really excited to be spending the rest of the hour talking about why I like to combine lasers with topicals, but more importantly, why I have grown so fond and so close to the Eucerin products, which have now become a very important part of my treatments. And what I would like to do, can I just suggest that we will leave the questions toward the end, because undoubtedly there are going to be questions, and please do ask and do challenge us, because we can all learn from each other and share. And I'm very honored to be participating with 3 fantastic colleagues from the beautiful Baltic countries. So can I suggest that we have the questions toward the end in order for all of us to participate and give our opinions and answers. So let's start. And this is who I am, and this has already been presented. But the important part which was missed, and that is actually I'm a friend of the Baltics. So I have been on a couple of occasions to Lithuania and to Latvia, and have done some training and teaching. I am waiting for the Tallinn invitation, but hopefully that will be soon. Okay, so this is the outline of the talk. We'll spend the first part of the talk on hyperpigmentation and how I incorporate the cosmeceuticals and the products from Eucerin range with my laser treatment. Then we'll move on to a very important topic, something that we all see a lot of in Northern Europe, that is rosacea. and redness. I will extend that not just to rosacea, but to facial erythema redness. And then we'll finish off with an important part, which is the aftercare. Because let's face it, you can do a laser treatment and you can learn the settings, but a very important part of the treatment is the aftercare treatment. And it's astonishing, having traveled to so many countries around the world, how that simple but yet very important part is often ignored or neglected. And this is why we'd like to finish off my talk by talking about the aftercare, and in particular the Eucerin products and how I can integrate them in the aftercare for lasers. So we'll start first with hyperpigmentation. Now, this is a very powerful slide. The message is the world is turning brown. Okay, so let me tell you one thing. If you think that because I'm based in central London that my patients are skin type 1 and 2, well, you got that completely wrong. They are in the minority. So probably 1 or maximum 2 out of 10, 20% of my patients are skin type 1 and 2. The vast majority of my patients are skin type 3, 4, and 5. And I also see skin type 6. This is a very diverse city, very multicultural city. So many of my patients, and in particular pigmentation, they tend to be the higher skin types. Now, what I have noticed that if you are in East Europe or if you are in Russia, you know, in general, your population mix with the lighter skin types is relatively forgiving and relatively straightforward. But I can tell you one thing, the world is turning brown. More of us are getting pigmentation. More of us are getting mixed in terms of marriages and races. And the more patients I treat with pigmentation, the more I respect pigmentation and the more I take that very seriously. Because if you just think it's a simple treatment in terms of a chemical peel or a laser, then that's a very naive approach. And over the years, I have personally myself been humbled and have learned lessons, and I have grown to respect pigmentation. And what I'm going to present to you is a culmination of years of experience and reflection, having treated many patients, including very dark skin type patients with pigmentation. So the world is turning brown, whether we like it or not. Okay, so the first question I would like to pose is, why bother with combination therapy? You can just buy an expensive laser or just go on a course for a chemical peel and then just offer that as a treatment. Now, we all know as dermatologists that combination therapy has its advantages. It optimizes the efficacy, it complements treatment, it increases patient satisfaction. We may be able to minimize or reduce side effects and downtime. So there are many advantages to combination therapy. And this is, I almost always combine topical treatments with energy-based devices, lasers in particular, when I'm treating pigmentation. And you will see why, and I'll try and explain that. So I'm just going to give you an example of one of my patients. Now, this, okay, is something that I see pretty much almost every week, okay? Now, I know when I have been traveling around the world and giving lectures, usually they will challenge me and say, what would you do here? Because, you know, they will think, ooh, this is a problem. You know, I don't want to touch this lady. But if I have that attitude of, well, I'm scared she might get post-inflammatory hyperpigmentation, I don't want to treat, then I might well as just stop being a dermatologist in London and move out of the city, because these are the cases that I'm challenged with. I see these kind of patients all the time. So I would like to just pose a few questions. Shall I just use a laser here, or what about adding the topical treatments? Well, she's going to ask me, the first question she's going to ask is, you know, I want the best treatments. Of course, she's paying a price and she wants to have the best treatment. Now, I can tell you, having treated many patients, is you get a synergistic effect when you combine topical lightening treatments with lasers. You just get that synergism, okay? Now, the other question she's going to ask me is it going to get darker? Am I going to get rebound pigmentation, or what we refer to as PIH, post-inflammatory hyperpigmentation post-laser? Well, there is a very good chance that she will get that, but it's my duty to minimize that, and it's my duty to try and implement steps in the treatment to minimize that. And it's not just as simple as, oh, avoid the sun and use a sunblock. That is a very simplistic advice that is not matched by a dermatologist that she's seeing. So I'm going to have to give appropriate advice and appropriate treatment to minimize the risk of post-inflammatory hyperpigmentation. And, you know, I'm already saying that's what I'm going to be doing in terms of the topical treatments. And one of the other factors is, if you're going to say to the patient, well, look, this might need 2 or 3 sessions, but if you combine it with topical treatments, we are going to get a faster response, a safer response, with less risk of post-inflammatory hyperpigmentation. So over the years, given this pattern of pigmentation, and as I said, I genuinely respect pigmentation because I have seen how it can just bite back. This is why it's instrumental for me that I combine topicals with lasers in practice. Let's go back to the basics. And I know that you're all dermatologists and you're all very familiar with this, but this is a very powerful image with a very powerful message. And that is, everything starts with the first step of melanogenesis. Basically, the melanin needs to be formed. You have a factory that's called the melanocyte, and that factory is just producing melanin, packaging it into these small melanosomes, and then distributing it. It's literally a factory. Think of a factory that produces something, puts it in boxes, transports it through the lorries into other parts of the country. And that's exactly what's happening. The melanocyte is producing pigment through melanogenesis, packing it into this melanosomes and distributing. What do? I'm not necessarily, pointing out any of my colleagues who are listening. What do? I will take a laser and treat. Fine. But let me tell you one thing. There is no laser whatsoever that actually stops the very important part, which is the first step, which is melanogenesis. So what lasers do, lasers will destroy the melanin or destroy the melanosomes, okay, will break down the melanin, but what the lasers can't do is switch off and turn off the melanogenesis. And coming back to this slide, when she's asking me, will the laser potentially make it worse? The question is, yes, possible, because you can get a rebound melanogenesis, okay, and that is something that the laser is not going to stop, but that is something that anti-pigment treatments, topical treatments, can stop and minimize, and that's what I will gonna give to her. So remember, the key thing is we have to go back to the basic, and that is basically melanogenesis that needs to be switched off. And pigmentation is a complex pathway. So we have the melanocyte that is active, then we get into this melanogenesis through the tyrosinase, then we get into the keratinocytes, and then it migrates through all the layers of the skin. Okay, so I have given you a couple of examples. So this is an example where I'll treat, for example, with an IPL. In this case, it was an intense pulse light. This is what you would like to see after a few minutes. You see darkening of the lesion. Why? Because of oxidation, melanin photooxidation. If I'm using a shorter pulse duration, so this is a long pulse duration, you get darkening, but you don't get white frosting. But if the pulse duration is shorter, if it's a nanosecond Q switch or even a pico, then you are going to get some frosting. And that is because the shorter the pulse duration, the more effect you're having on the melanosomes. And you can see in this image, you get that subcellular melanosome destruction. So when you are using the laser, you're either destroying the melanosomes or you're oxidizing the melanin. But what the lasers can't do is inhibit tyrosinase. And that's exactly what we want, because otherwise we're going to get this rebound and recurrence. And every week I get an email from one part of the world, from countries, hi, Dr. Fras, I have treated this lady with pigmentation, now it's got worse. And that my immediate question is, what was the care beforehand? How did you prepare the skin? And what tyrosinase inhibitors did you keep it after the laser? Now, you can imagine that most of the time the answer is, well, we don't give, because they just want to rely on lasers. Well, as I said, I have been humbled myself over the years, because this is how you learn by practice, and you learn from patients. So the key take-home message really for you is, as much as I love lasers myself, The one limitation when it comes to pigmentation is that it simply does not inhibit the most important part, which is the tyrosinase and the melanogenesis. And that's why we need an ideal treatment that complements the laser treatments, whether that's photooxidation or melanosome destruction. And we need to prevent, because remember, medicine starts with prevention. That's the first thing I learned when I was first year medical student, is medicine starts with prevention. So now that leads me into introducing the product itself, which is called the Eucerin anti-pigment range. Now, this is a range that over the last 16 to 18 months I have been using tremendously. This morning I had 3 Zoom consultations, and 2 of them were pigmentations, and 2 of them received anti-pigments. And I'll tell you why. And that is because of this key unique ingredient, which is called thiamidol. Now, thiamidol is only a patent of Eucerin, so you cannot find thiamidol in other products. It's only found in Eucerin. But this is a non-prescription and it's available over the counter. But it's a very powerful inhibitor of tyrosinase. Now, one important thing that I must confess that I didn't know until I started reading the clinical papers and the scientific papers of this product, what I didn't know, having been using tyrosinase kinase inhibitors for many years, including hydroquinone, is that all of those tyrosinase kinase inhibitors were only tested on mushroom tyrosinase. I didn't know that. I thought and assumed that they were tested on human tyrosinase. But in fact, thiamidol is the only chemical compound that has been tested on human tyrosinase. And that is because after spending time with the scientists in Beiersdorf and discussing with them, it is incredibly difficult from the scientific point of view to be able to extract sufficient amount of human tyrosinase and conduct high quality scientific studies. So hydroquinone, kojic acid, all the other brands that you like, or the flashy brands and the expensive brands, and even the brands that are featured through fashionistas and Instagram, that those tyrosinase kinase inhibitors have only been studied on mushroom tyrosinase. But what we want, because we are human beings, we want a compound that has actually been tested on human tyrosinase. And that is the strength and the unique feature of thiamidol. So thiamidol is the only chemical compound that has been tested on human tyrosinase. But that's not the whole story. It also reduces visible light pigmentation. Now, I will going to be speaking about visible light because I'm very passionate about it, and it's a hugely important topic. From now on, in conferences and scientific papers, you are going to be hearing a lot about visible lights. If we just talk about UV light, that is the past, the present, and the future is UV plus visible light. Which means, you know, the mushrooms we can save for pizzas. In fact, I remember I was in Vilnius and I was invited by a colleague. I hope she's joining in. And I had a very nice meal with mushrooms. So we can leave the mushrooms for the meals and for the pizzas, but the mushrooms are not there to dictate our tyrosinase kinase. We need a compound that's been tested on human tyrosinase. Okay. So thiamidol, well, it's a very active ingredient, okay, in terms of reducing the tyrosinase kinase and the melanogenesis. But in addition, the anti-pigment range has a unique partner together with thiamidol, and that is called lycocalcone A. You see that here in the second slide from the left, which is Lyco A. And lycocalcone A, you're going to be hearing about, is another very important molecule. So when you look, and that's the first thing you want, is whenever you're being presented with a new product or a chemical compound, the immediate reaction should be, where is the evidence? Show me the studies, give me the papers. And I think this is the one thing that I like so much about Eucerin. And by the way, Eucerin was founded by a dermatologist. And I think this is a very unique feature for me, because as a dermatologist myself, I very much would like to work with a company that was actually founded by dermatologists and is still very, very keen to work with dermatologists. Unlike some other companies that are purely there just for branding, I think we as dermatologists have this duty to collaborate with a company that really champions our specialty and our science. This is one of the studies that was performed where you can see actually that this was compared, so the thiamidol active component was compared to some of the other commonly used melanin inhibitors, such as cysteamine, azelaic acid, and even the increasingly popular tranexamic acid. And you can see on the right side from the image, you can see the reduction in the melanin. And you can see that from the chart. And all of these studies, by the way, are available and published. And if you contact the team of Bayersdorf, where you are, you will be able to get copies of all these studies. Now, this is mine, and you feel free to contact me, and I will be very happy to send you this because it took me a lot of time to write and publish this, and I will be glad if someone reads it. But I have made life easy for you because each time I go to a conference, the question is, what are the cosmeceuticals for anti-pigment? So I decided to publish about it, okay? This is the list, the table in my article about the common, mostly used cosmeceuticals. And I looked at it from the point of view of evidence, but particularly in terms of the strongest evidence of reduction and inhibition of tyrosine kinase in humans. And you can see that's why thiamidol is being put on top, because if you go through the scientific level of evidence, as you know, that there is a level of scientific evidence in terms of how the evidence has been extracted, thiamidol really comes on top. And no surprise that within the last couple of years, multiple articles regarding thiamidol have been even published in very high impact factor journals, such as Journal of Investigative Dermatology. Okay, so I want to spend some time talking about melasma, because trust me, if you think melasma is challenging, and if you think that melasma is challenging in a skin type 1 and 2, okay, please feel for me when it's challenging in a skin type 4. So not only in a skin type 4, I'm battling melasma, but I'm also battling her own pigment and trying to make sure that I clear the melasma, but not worsen her pigmentation. And I've seen so many patients with melasma that I genuinely respect this condition. Now, the one thing that you really need to know from this webinar is melasma is not just a hyperpigmented patch. Melasma is not an increase in pigmentation. Melasma is a complex condition whereby there is melanocyte activation and increased pigmentation, in addition to the following. There is basement membrane damage. There is solar elastosis. There is increased mast cell activation with tryptase. And there is increased vascularity, and we all now agree. And as a result of the increased vascularity, there is also increase in endothelial cell activation, and in particular, endothelin that's being secreted. This is why we all know that tranexamic acid has become a very popular treatment for melasma. Oral tranexamic acid for moderate to severe melasma is something that I routinely do now, because it's a great treatment in combination with the topical treatments, okay, and the lasers for those who want the lasers. So how does it work? The tranexamic acid is working on a number of levels, okay? Tranexamic acid is working by inhibiting the conversion of plasmin to plasminogen. So we now know that ultraviolet light and visible light induce plasmin. So we call that UV-induced plasmin activation. So this is why when a melasma patient goes out in the sun, they get increased plasmin. That plasmin is being converted into plasminogen. The plasminogen is going to then activate arachidonic acid into the prostaglandin, and you get activation of the melanocyte. When we use tranexamic acid, we are blocking the conversion of the plasmin to the plasminogen. But that's not the whole story. Tranexamic acid also inhibits the mast cells, but most importantly, it acts on the endothelial cells as well and blocks that vascular component. So we know that a vascular component, an endothelin secretion through the active endothelial cells in patients with melasma is very important. But it doesn't necessarily have to just be tranexamic acid that we use, because we know that the other ingredient that's in this range of antipigment, which is the lycocalcone A, inhibits that. The lycocalcone A inhibits the endothelial cell activation and therefore contributes to the clearance of this complex pigmentation. It also inhibits, it has an anti-inflammatory effect, and as I said earlier, it inhibits the visible light. And here again from a study, for those cells that were enriched with lycocalcone A, so once again, lycocalcone A is another ingredient that's found in the antipigment Eucerin range, together with the thiamidol. Thiamidol, which is the key molecule, inhibits the tyrosinase kinase. And lycocalcone A inhibits the endothelin, has anti-inflammatory effect, and has antioxidant effect. So triple effect, very important molecule that has been added on to the thiamidol in this product. And we all love antioxidants, let's face it. I mean, this is my article on these, both of these are my articles on the left-hand side. This is about 6 years ago, when I was part of an international group and we did research with CE ferulic, that was from SkinCeuticals, because it had a high concentration of vitamin C. We did studies on, and we found that it decreased the erythema and the downtime post-ablative lasers. But when we looked at certain molecular levels, we also found that it was very protective because we had an increase in basic fibroblast growth factor. So we know that antioxidant, and on the right-hand side is another article of mine, which again, if you contact me, we'll be more than happy to send these articles to you. And we found that high concentrations of vitamin C, which is essentially anti-inflammatory antioxidants, and particular antioxidants, are very helpful in reducing downtime, reducing UV-induced erythema, and accelerating wound healing post-lasers. So this is not a new thing that we know about. We talk about it all the time. And by the way, Eucerin has a very good, nice new product for vitamin C. I'm not sure if it's available in the Baltics or not, but I love it. I use it myself and it's absolutely fantastic. And that's the vitamin C. But we can't just rely on vitamin C. We were going to have something else. And this is why I like the lycocalcone A that has been added to the thiamidol in this Eucerin product. Now let's spend some time about visible light, because once again, I said, you're going to be hearing a lot about visible light and it's very important. We now know the thinking in 2021 is that melasma is not just exacerbated by ultraviolet light. There's definitely the visible light, and in particular the wavelengths between 400 to 500 nanometer, so particularly the blue light, and sometimes it's termed high energy visible light. In a sunny day in Vilnius or in Tallinn at 12 o'clock in the afternoon, probably about 40% of the light is visible light. And a lot of that will gonna be within the short wavelength of the blue light. And we know now that it activates the keratinocytes in producing plasmin and increasing pigmentation, in particular in patients with melasma and post-inflammatory hyperpigmentation. This is a seminal original article published in the Journal of Investigative Dermatology. Such was the importance of this article that the journal has made it available free online. You don't even need to purchase it. If you go on GID, you'll find that it's available free because of its importance. Those of you who keep up at best with the developments, this is a very recent article in a highly respected journal, the Journal of American Academy of Dermatology, which is often referred to as the Blue Journal, talking exclusively about the photoprotection and in particular the use of certain sunscreens that block visible light. And this is the conclusion. Look at the capsule summary. Ultraviolet radiation and visible light have an effect. And if you look at the table below, dermatosis aggravated or induced by visible light, we have melasma on top, post-inflammatory hyperpigmentation, lichen planus pigmentosa. Now, what do we commonly see in our hyperpigmentation clinic or laser clinic? We see melasma. We see post-inflammatory hyperpigmentation. I see them every week. So we now know that photoprotection doesn't stop by ultraviolet light, and blocking visible light is absolutely vital. Now, a very basic question will be, how can I block visible light? Now, you block visible light by using lycocalcone A. And lycocalcone A is one of those chemical ingredients that's in this anti-pigment range, both in the day cream as well as the night cream. And to add further to that, thiamidol also has visible light protective agents. Okay, so lycocalcone A, this is another paper that specifically looked at suppressing the upregulated pathways that are upregulated upon exposure of the skin to visible light through particularly the NRF2 pathway, and lycocalcone A blocks that. So once again, lycocalcone A is found in the day cream as well as the night cream. And lycocalcone A, therefore, has, in addition to antioxidant, anti-inflammatory, anti-endothelin properties, it also blocks visible light. And again, of course, if I get the chance, I will publish on this. And this is a recent article of mine in Clinical and Experimental Dermatology, again, where we just talked about the importance of visible light and hyperpigmentation, because that is something that is becoming a very important part of pigmentation. So thiamidol, some cases when it was compared against vehicle, you can clearly see the reduction and the improvement. You can see that in the before and afters. And again, when it was looked at in patients with melasma, the MASI's, the Melasma Activity Severity Index score, you can see compared to the vehicle, you have a drop and improvement in the MASI score. And even patients themselves, they like it, and that's again another very important factor, because whatever you prescribe or suggest to your patients, most importantly is they need to just like it. And we know now that reduction of hyperpigmentation will lead to improvements in the quality of life. Now, so let's pause for a second, because this is interesting, and this is where I also get very passionate about, because now we're venturing into the territory of lasers. Let's just pause for a second. So in this range of anti-pigments, the key molecule is thiamidol. Now, why is thiamidol important? Thiamidol is important because it inhibits the first and the key step in melanogenesis, and that is basically the tyrosinase kinase. So it blocks the tyrosinase kinase inhibitor, and it's the only tyrosinase kinase inhibitor that's been tested on human tyrosinase. So that's the key important thing to remember. The next important point to remember is that the range, as the morning as well as the night cream, contain lycocalcone A with 3 key mechanisms: antioxidant, anti-inflammatory, and more importantly, blocking visible light, that we now know plays a very important role in post-inflammatory hyperpigmentation as well as melasma. Okay, so far so good. Now, here is the question. So you get pigmentation and you get a Thai or, a Japanese or a Korean lady. So basically that's just my average patient here in London. And they say, I want a laser. Now, if you just pick up the laser and try and do some low fluence Q-switch in Diag or your more expensive Pico, whatever it is, and just treat it, that's, once again, with all due respect, that's a very naive approach. And I did that before, and that's why I learned not to do that anymore, because you are going to get that rebound hyperpigmentation. Now, this is a study that comes from Thailand, and what they have done here, it's a split phase study. Anytime you see a split phase study, take that study very seriously, because it's the best way of getting that evidence through the split phase study. So what they've done is here, the whole face was treated with low fluence Q-switch, which is the laser toning, which is the method that we use for post-inflammatory hyperpigmentation and melasma, particularly in the higher skin types. But in one half, it was added the anti-pigment I'm not the other half. And you can clearly see, and also from this article, that in the half that the combination treatment was done, i.e. low fluence Q-switch laser plus the anti-pigment creams, they had better improvements. It makes sense. And I 100% agree with that because that's my practice as well. I always tell patients, in fact, it's in my consent form that they must sign that they will adhere to the sun protection and the lightening creams that I prescribe them, and they know that they will have to continue to use them afterwards for maintenance, and failure to do so, that's their responsibility, because you just get better results. That's not the whole story. So it's not just the synergism in terms of getting better results. Let's look at this other study that was recently published in Lasers in Medical Sciences. Again, a very respected journal, and this comes from China. So all the countries where they see a lot of pigmentation, where melasma is a problem, and where they do a lot of lasers. What they found in the study is that you actually get barrier skin disruption and increased transepidermal water loss following the use of laser Nd:YAG for melasma. Now remember, when I said about melasma, it's not just hyperpigmentation, but there is basement membrane damage, there is solar elastosis, there is mast cell activation, there is endothelium secretion by the endothelial cells. So we know that there is an issue with basement membrane. And how do we know that? That's why we get dermal melasma, because you get this incompetence at the basement membrane level, and you get this dropping of the pigment, which we refer to as pigment incontinence, that's going to be taken up by the melanophages. But that pigment that's dropping from the epidermis into the dermis, that is because of the incompetence of the basement membrane. So we know that there is an issue with basement membrane, but what we didn't know is that that issue with basement membrane and increased transepidermal water loss and barrier dysfunction is actually worsened post-laser. So what do we need? We need to strengthen the barrier as well. And that is part of the treatment to prevent rebound pigmentation. So how do we strengthen the barrier? We strengthen the barrier by using the right products that have been shown to repair the barrier and reduce inflammation. And one of those is dexpenthenol, which is another active ingredient that's found in the night cream of the anti-pigment range. And this is why I have grown so fond and so close to this range, because it offers me at scientific level, and let's keep it very scientific, please, because we are dermatologists, we are not beauticians, or we are not just doctors trying to sell a treatment for the money. We are dermatologists, and it's our responsibility to incorporate the science into the best clinical practice. And what I have in this range is I have the thiamidol, which is the only tyrosinase kinase inhibitor that's actually been tested on human tyrosinase. I have lycocalcone A that has an anti-inflammatory, antioxidant, and blocks visible light. But I also have dexpenthenol, which stabilizes the barrier function and decreases transepidermal water loss. And that is important because that gets worsened after low fluence Q-switch or pico laser. And this is why I insist on the use in combination with the laser. So the range, there's the day treatment, which in addition to the thiamidol and the lycocalcone A has the SPF. Then the night one doesn't need the SPF, but still has the thiamidol, lycocalcone A, and instead of the SPF, it contains the dexpenthenol. And then we have the dual serum, which is my favorite as well, because it contains hyaluronic acid. And patients say it feels really smooth, very hydrating, and patients like it. Now, those of you who have used other tyrosinase kinase inhibitors, including myself, where I used to use hydroquinone, a lot of time they'll come back with dryness and the flaking and the irritation that's available. Now here, patients will say, do I need a moisturizer afterwards? I said, no, you're already having a moisturizer because the dual serum has hyaluronic acid in both the long as well as the short chain. And as you know, the short chain hyaluronic acid is going to get deeper into the skin and give us that sustained hydration, and the long chain hyaluronic acid is going to give us that immediate hydrating effect. So this is one of a popular one, and in particular for hyperpigmentation around the eyes. You know, for women who come with pigmentation and dark circles around the eyes, I always say use the dual serum, because we know that hyaluronic acid just plumps up the area, and hydration with hyaluronic acid helps there. This is why there are all these meso hyaluronic acid treatments and skin booster injections. You can just say, you know what, for the whole face, use the morning and night ones and top it up around the eyes with the dual serum. So, some slides in terms of the progression that you see with the anti-pigment range. Once again, that's thiamidol, lycocalcone A, and dexpenthenol. This is how it looks. This is the dual serum, and you can see there are two chambers, and when you pump it, you'll get the mixture of the thiamidol plus the hyaluronic acid. Now, this is one of my patients. Again, look, dark skin types. Now, this is from the left. Now, I'm not going to just do laser because I know it's just going to get worse. But I will prep her with the anti-pigments and the strict sun protection. Will continue to treat with the laser and continue with the topicals. So basically, they are having the pre-treatment and post-treatments, and I tell them that the topical will going to be a maintenance. Now, whether they will continue with the morning and night one only or the morning one, that is a discussion I will have with them. But this is another example where with all the combination treatment, by the way, she's Lithuanian, with all the combination treatment, I managed to clear her to the right. But I will be very naive to say, thank you very much, goodbye, just use sun protection. Sun protection, that is just not, to me, that is inadequate. What I need to say to her is you need to have something that blocks visible light. You need to have something that has the anti-inflammatory, and you need to have something that blocks the tyrosinase kinase. So I got her from there to here, but now there is no more role for the lasers, but this is where it's absolutely vital to keep her on the topicals for maintenance. It's also important when we talk about the sun protection to look at the range that we are going to combine with the anti-pigments. And why is this range particularly important is because it doesn't just have a chemical photo blocker that is blocking ultraviolet light. Look, it contains lycocalcone A, so we know it blocks visible light. It also contains thiamidol. So I tell my patients, when you're using this sunblock, you're actually also not only preventing pigmentation, but treating potential pigmentation, and it also repairs the DNA. The cleansers are something that you can also incorporate, but it's important to understand that the sun protection from this range contains both thiamidol as well as lycocalcone A. So, why is Eucerin anti-pigment range suitable to combine with lasers? Is because we know that when we combine topicals with lasers, you get synergistic effects and reduces side effects. We know that what lasers can't do is inhibit melanogenesis, which is a very important step. It is the key step. And for that, we need an active ingredient, and thiamidol is that active ingredient. We also know that there is an issue with skin barrier in patients with melasma and in patients post-laser. And dexpenthenol, that's found in the night cream, can improve on the skin barrier. We also now know the importance of visible light and how we can block that, and we can block that with lycocalcone A that is found in all the range, the day cream, the night cream, as well as the sunblock. The dual serum has moisturizing effect because it has hyaluronic acid and therefore no peeling, no dryness, and particularly suitable for post-laser treatments. There is no risk of melanocyte toxicity, such as, for example, compared with some of the aggressive ones, in particular hydroquinone, long-term hydroquinone use. And again, this is actually very, very important. You know, when you sit with patients, and, you know, you can have a very fancy clinic and you get the celebrities, that's fine. But at the end of the day, we're dermatologists, we're doctors, and we're treating patients. And I get patients from students all the way to top celebrities. But when I am going to say to a patient, you need an antioxidant, and you need a sunblock, and you need a day cream, and you need the night cream, some patients will say, doctor, is that going to cost me a lot? And some of the brands, the very flashy brands, they can be very expensive. And I think the beauty of the Eucerin range is that it's affordable. I'm not saying cheap, that is not the case, because there isn't anything that is good that is cheap, but it's affordable to patients. And I think that is an important point that is often overlooked when we actually treat patients. So this is why I always combine the anti-pigment series in the vast majority of cases when I am treating pigmentation with lasers. So this brings me into the second part of the talk, which is rosacea, and I would extend that to redness. Now, again, a very important topic, because we all see patients with rosacea all the time. And again, and if you have seen enough patients with rosacea, I bet you are going to have those questions of what cleanser shall I use, which moisturizer, can I show you, can you give me the skincare advice? Oh, I want to go natural. You know, there are all sorts of issues beyond just a simple prescription of an antibiotic and a cream. And also just, well, let's do a laser. We know, and this is just one article in Clinics in Dermatology by a very, very famous author, Zoe Drollis, cosmeceuticals for rosacea. We know it's big. We know it's absolutely big. The cleansers that we use, the barrier protection, calming down the inflammation, the sensitive skin, all of that is important. It's a huge, important part of the topic when it comes to rosacea. And again, just like with pigmentation, we know that combination therapy, so that is using the cosmeceuticals plus, for example, the lasers, whether it's the IPL or the pulse dye laser, we know it enhances efficacy, it optimizes it, increases patient satisfaction, and therefore potentially also minimizing side effects. So, patients of mine, look, you can learn from textbooks and you can learn from articles, but the best schooling for me is learning from patients. And you know, I didn't appreciate that when I was a medical student, but my seniors were always saying the more patients you see, the better you get. And this is what differentiates experience, really. So the lady on the left with her eyes covered, I mean, severe redness and very vascular and hyperactive. And yes, I say to her, look, I'm going to clear this with a few sessions of lasers. But she's saying, look, I need to cover this up. This lady can't socialize and interact because this redness is just debilitating to her. And what struck me the most is her saying, you know, I initially gave her something from a different brand, that is before I came into contact with this particular product I'm going to talk about. And she said, my problem is I still need to hide it with makeup and foundation. And that struck a chord with me, because we can just suggest treatments to patients, but is it actually the best option for the patient? And is it practical for the patient? So a practical solution is what they want. The middle image is a lady who just finished a laser treatment, and she panicked and sent me this photo and said, I am very red, please advise, what shall I use? Again, I mean, I do lasers all the time, and you're going to get post-laser erythema and redness. And you know, in many cases, yes, it will calm down in a day or two, but in many other cases, you want to calm that down. And again, you want to just make sure that it doesn't flare up. So there is this post-care. So on the left-hand side, we have a patient who's having active treatments, but she also wants something against the sensitive skin and to camouflage it. In the middle picture, we have someone who's just had laser, but she wants to calm down this redness. And on the third, that's just peeling from a recent sublative treatment, and she needs treatment for both the epidermal repair as well as the redness. So there is a range of presentations for patients with redness and red skin will seek our advice. So what I found is that it's important that we also calm down this hypersensitive, hyperreactive skin. And this is a unique product that I am now using pretty much all the time on my patients with rosacea because of the green tint. So if I come back to this patient on the left, she's saying, well, I need to still use a thick layer of foundation to cover and camouflage that redness. Now, those of you who use a pulse dye laser will know that we have this green beam of light. And those of you who just remember from physics, we know that each light has a complementing light that it absorbs. And the complementing light color for red is green. And this is why the green tint is particularly suitable for camouflaging redness. But that's not the whole story, because you can get this anti-redness without the green tint. And that is because it has an SPF, but it has two key ingredients, and that is Sensitive, which has a calming, anti-sensitive skin effect, and our favorite, lycocalcone A, anti-inflammatory, and remember, blocking endothelin, which comes from the active endothelial cells, and blocking visible light. And again, visible light also can cause irritation for those patients with very sensitive skin and redness. So the Eucerin anti-redness is useful because in addition to the sun protection, it has Sensitive that calms the skin down. It has lycocalcone A, antioxidants, anti-inflammatory, and blocking visible light. And there is the concealing one, which has the green tint, and that is particularly suitable for those who just want to treat the redness, but also to camouflage it and cover it up. So this is why it's unique. And the other products from other companies don't have that green tint. And this is a great bonus and an advantage. So once again, these are the ingredients that we have. The Sensitive, unique and patent to the Eucerin. So it has a very anti-irritating, skin calming effect. I actually use it a lot post-procedures. You know, when you do a procedure and after a week they say the skin is a little bit sensitive, whether you do a chemical peel or a laser, Sensitive anti-redness is particularly great for that. It has the lycocalcone A and the green pigments. But what it doesn't have is all these, the fragrances and the alcohol base and everything that potentially can irritate hyperreactive rosacea red skin. And again, you should always ask for the studies, and the studies which were done showed that it reduced the redness, but also patients were very happy. This is, again, the range in terms of the anti-redness. So there is the soothing cream, which has all these ingredients, the lycocalcone A, the Sensitive, but without the green tint. And you have the anti-redness concealing cream, which has these ingredients plus the green tint. And for those patients with super sensitive skin, there is the ultra sensitive redness as well, with fewer ingredients, particularly there just to soothe and calm the skin. And once again, you can see from the studies that it reduced the redness, and patients were very pleased with that. Redness, so just like with pigmentation, reducing redness post-laser and patients with rosacea sensitive skin is of huge importance and is a common presentation to clinical practice. Now, finally, and I am running well on time, so I'm pleased to see that. I'm keeping an eye on the time. Post-laser, as I said, very simple, but hugely important, okay? And this is, I think, that differentiates us from others who just want to buy a laser and do the treatments, because that's where the difference is, because part of the treatment is the aftercare, for sure. Post-laser skin repair and protection. So this, I don't know if you can guess or not, but what you have here on the fingertip, that's Aquaphor. Now, let me tell you something about Aquaphor. Almost a decade ago, I was at a meeting in the US, and I went to one of the lectures on lasers, and everyone who was asked, that's in the US, from these eminent speakers and users, oh, what do you use afterwards? What do you use afterwards? They were all saying, oh, we use Aquaphor, Aquaphor, Aquaphor. I mean, if you go to the American Academy of Dermatology or the American Society of Dermatologic Surgery or any conference in the US, I guarantee you are going to be hearing Aquaphor, and American colleagues love it. And in fact, each time I used to communicate with some colleagues about cases, they would say, well, I'll just continue with the Aquaphor. And I didn't know. I just thought Aquaphor was just petrolatum. I essentially thought, well, it was just, you know, a modified type of Vaseline, because that's what many were using at the time. But of course, I was proven wrong, and this is how we learn. Aquaphor is actually a unique product, because it's has this semi-occlusive film. So the Vaseline and the petrolatum, I mean, look, that's something that we don't use and we shouldn't use because that is just occlusive, and that's where problem starts. But this is a semi-occlusive one that allows for the transfer of water, vapor, and oxygen. So basically, breathable skin. So whatever you put on the skin, in this case the Aquaphor, it allows the skin to breathe without the occlusive effect. But that's not the whole story. Look at the other ingredients. In particular, the combination of this paraffin plus cera microcrystallina and ceresin that is unique to Eucerin has this semi-occlusive hydrating and barrier protection. But in addition, it has panthenol, okay? In many countries I see, particularly in Russia, they just like to use bepanthen after procedures. Well, bepanthen, when I looked at it, is nothing other than just panthenol. That's just panthenol. A very basic ingredient. And that basic ingredient is found here. But in addition to glycerol and bisabolol. Now, bisabolol is something that I knew from years ago when I was doing a research project with the CE ferulic from SkinCeuticals, because we know that some of the SkinCeuticals products contain bisabolol, particularly the retinol. And this is why they're saying that it's less irritant. So I know about bisabolol and how important it is as an anti-inflammatory calming effect. So in this tube of Aquaphor, that is significantly cheaper than many of the other flashy barrier repair treatments. I have bisabolol, which I really like. I have glycerol as a moisturizing effect. I have the panthenol for those of you who are very fond of bepanthen. I have this lanolin alcohol, which is called the Eucerin, together with the combination of the paraffin, cera, and ceresin that gives that semi-occlusive barrier and enhances barrier repair. And this is why now I understand why many of my American colleagues were so fond and happy with the use of Aquaphor, because now I have a much better understanding of the detailed ingredients. And this is what I use. So when I'm using the CO2 laser, or I'm using the fractional non-ablative, I use the Aquaphor, and depending on some of the other products, afterwards we'll start introducing the anti-redness when the skin is red, and the sun protection. But for the sort of like immediate care afterwards, it is the Aquaphor. And there are clinical studies again with post-laser treatments, post-laser resurfacing, and wounding. So on the right-hand side, that's again my patient. So she had an aggressive treatment with a thulium, and is starting to just shed that brown skin, and Aquaphor. And she emailed me back, said, I love it. It's nice and smooth and not that greasy and oily. And that's, once all of that is over, then I can start introducing the anti-redness. And depending on the degree of camouflage you want, it will either be the anti-redness with the green tint or the calming anti-redness without the green tint. And again, looking at the studies, and again, these studies have been published, and Eucerin and Beiersdorf can send them to you. When it's compared to the untreated side, or even there are studies when it was compared to topical antibiotics, it healed much better. I mean, topical antibiotics, post-laser treatments, I don't use, and I don't encourage that. Higher chance of sensitization, higher chance of dermatitis and infections. So that is, not common practice. But the use of Aquaphor has been shown to be superior than the use of antibiotics, and no surprise, superior to no treatment. And then again, just to highlight the importance of the range of the sun protection, because the sunblock should not just stop once again by blocking the UVA and the UVB. We need to go beyond that. So we need to go to block the blue lights and the visible light. So HEVS stands for high energy visible light. So lycocalcone A is found in the sunblock, so that is blocking the visible light. Then there is this ingredient that I always struggle to spell, glyceretinic acid, which protects the DNA, and we know that DNA damage is what gives us solar keratosis. And therefore, this sunblock is unique because it blocks UVA, UVB, visible light, as well as DNA protection. And in the oil control one, it also has L-carnitine, and L-carnitine is an absorbent of sebum and oil, which means that for these greasy skin, they are not going to be having a shiny look. And that is very, very important, because this is what the young girls always complain about. I don't like the sunblock, it looks so oily and shiny, and many of them are concerned that they will get actually acne. So I reassure them that this is non-comedogenic, it has a hydrating effect because it has hyaluronic acid, blocks the visible light, and it has L-carnitine that absorbs that sebum, so it is not oily and shiny. And again, this was studied on 26 patients with a very high tolerability and improvement scores. And I have kept the time, and this is probably my favorite slide. So on the left-hand side, you can judge how happy I am from the width of my smile. So that's in Vilnius with my colleagues in Lithuania, and on the right-hand side, that's with my colleagues in Riga and Latvia. I want to thank all my colleagues who were involved for their hospitality, generosity, and their friendship. And as I said, I am awaiting my invitation to Tallinn. And I hope you found this stimulating, and I hope I managed to just let you think and consider using some of the products in combination with the laser. Now I will stop sharing my screen and I will hand over to my esteemed colleagues, where I'm very keen to listen to their presentations too.
Thank you, our dearest Baltic friend, Dr. Firas, for your great presentation, for your nice words. So I would like to present second speaker, Ruta Gancevičinė, our doctor expert from Lithuania. So please, Ruta, your stage is yours.
Thank you, and really I am very pleased to having possibility to participate in such special event and to be together with our doctors, our colleagues from all Baltics, independently that this is not in real life, but we can feel hearts of them. And really thank you, Eucerin, and you, Elena, and Sandra, for trusting in me. And it's a big challenge to talk after such a very well-known doctor from various world conferences. But I will try. I will try to share with you my knowledge, my practice in interventional laser dermatology. I would like to begin from this, that I really love this specialty because it's so elegant. It's like a black dress. Still till 2029, it's modern, and you never be wrong when you wear it. It's similar with laser, and many patients, of course, think that this is a miracle. And if you look to such pictures, the real life of patients, you can say that laser dermatology is really not only aesthetic; it's real life of our patients. And but nevertheless, I agree with them that laser can do a miracle for them. Just we need to teach them. We are artists, but we don't have a special painter. We cannot paint the faces. Yeah. So we cannot as well to give a mirror and to change face in one moment. And we know that all lasers, all procedures have some common side effects. Even independently that they are temporary and transient, we expect and we desire, it's like our desired clinical endpoint. Erythema, edema, bruising, post-inflammatory hyperpigmentation, perifollicular erythema, and other. And we know how to manage them. Like, for example, procedures with vascular lesion. the skin become red with edema, bruising, but still we don't have tissue integrity. But patients feel hot, patients feel very tenderness sometimes. So we should know how to help them right after procedure and later at home. Here, you see, it depends on the what we do. And if we work with ablative lasers, with full beam ablative lasers, we can make a miracle from the witch to make normal people. And some actors even had stories that they couldn't make the normal role after the removal of mole on the nose. So we have really very little, very nice lungs, and they heal very nicely with a good managing of this wound. Other thing is that we have possibility using ablative lasers to make skin resurfacing. And we can choose a kind of laser. We can choose the depth of what we do. We can choose the warmth, the length of the beam, etc. What you all know. But what happens after procedure? Of course, we are trying to diminish wrinkles, but the post-procedure period is really sometimes horrible. And at that time, when patients come after 3 days after procedure, after a long weekend, I was shocked. And at that time, we didn't have Aquaphor as well. And she decided not to wash the face, just to be like it is and to heal herself. And it was really a huge, huge mistake. With the prescription, what we said, with recommendations, in 1 week the view changes a lot, and in 1 month it was really nice skin. And keeping in mind that this ablative laser treatment with medium peel has name velvet skin, can you imagine how patient can feel in the first days after that? But when fractional laser came to the market, everything changed a lot, because the view right after the laser, you can see, is very different. But still we have pinpoint bleeding, oozing, and etc. And crusting after revitalization. Redness can be seen in several weeks, and it varies among patients. But nevertheless, in a month we have really nice renewed skin. Again, scars correction, we can use combined lasers together, ablative and non-ablative fractional lasers with many little holes on the face. And as well, they heal right nice. But if you have such challenges, unique cases, for example, with severe acne, and after the treatment with Roaccutane, or it's your choice what you use, I use Roaccutane, and still there was huge scars on the face of very nice, very intelligent young person. After the laser, he looks like this. But later, after several procedures, you can see a smile on his lips. And it's really what we can say. It's a miracle, I think, for this person and for us as well, that we can help them. What our purpose is, it's really important. Like Dr. before said, that it's only part of our work, of our job to use laser. Other very important part is wound healing and manage wound healing. And we know that we have to make the skin functionality and integrity like it was before, or like it is skin around the thing what we should remove or we should repair. And so we should accelerate epithelialization. We should protect against the infection, of course, free radicals, and control inflammation and cell proliferation, and reduce, of course, risk of hypertrophic scarring and hyperpigmentation after procedure. And as early as possible, we should do something important for our patient just in the first week and just immediately after the procedure. And what we can do, if it is pinpoint bleeding, of course, we can control with brief pressure. If we signs of inflammation, pain, erythema, tenderness, oozing, we can use cooling mask, wet dressings, partially occlusive bandages, and we should use permanent skin lubrication. And only ointments, they can keep wound surface clean, moist, insulated, protected, and less sensitive. And Aquaphor is just like a source ointment for this, of course. What else? Infection prevention. American, we like to prescribe antibiotics anyway. When we do threads, when we do laser, just to be safe, on the safe side. Antiviral, yes, of course, we should think about this if patient has recurrent herpes virus infection. But what kind of ointments we should prescribe, and I will introduce you later a little bit. At home, it's very important to give them homework as well. And patients, of course, they asking, can I do sporting? Can I go to the job? They are not patients at the hospital, and procedure is not like a procedure at the hospital. They can be physically active. Just they should not stand in standing water, not go to the pools, to the hot tubes, ocean, lakes, etc. It's contraindicated, and those skin become fully revitalized, and they need gentle cleansing. And the best thing is with a little bit acid spin, we have the pH medium support. Cold compress and ice packs can minimize swelling, redness, and soothe irritated skin. So there are really a lot of, and Eucerin have masks, they can really do this. And managing of sensitivity. You can imagine how sensitive skin is, and we really cannot put the same product what they use at home every day, because the skin is just irritated, and everything what we have ingredients in the cream or serum or elsewhere, they go deeper into the skin, and everything will sensitize the skin. So proper moisturization is really very important, and not once per day, even not 2 times per day, but many times per day. And they should skip strong ingredients. They should later use anti-pigment, especially anti-high protection products together too. And for pain medication, for the postoperative pain, if it is required, maybe paracetamol, not anti-inflammatory drugs. Why? Because we need information what is in the skin, in the face especially, because skin then fighting with everything. It become renew. It's very important for the renewal. Makeup, okay, they can cover redness of the skin when they have such condition, of course, not on the oozing skin. And so, what kind of moisturization we can prescribe, we can recommend for them? And here we go to the principles of topical wound care after the treatment with lasers. We should keep wounds clean, moist, protected. And to remove impediments is really very important for repairing. And topical compounds should support all 3 wound healing phases. And usually recommendations go to the topical antibiotic-based ointment or white petrolatum. Talking about topical antibiotic-based ointment, okay, we can reduce possibility of the infection, and some of them really can give moist environment and promote healing a little bit, but overuse of antibiotics is potential increase of drug resistance. And what was interesting for me, like for dermatologists, that, for example, it was a study that the persons, they are using topical erythromycin or clindamycin for acne treatment. They have cross-resistant strains of Propionibacterium acne. And can you imagine that it can be transmissible? Because in fact, resistant strains of Propionibacterium acne have been found and occur on the skin of the untreated family members who live together with this person. So that means that we should avoid antibiotic as much as we can. White petrolatum, okay, is safe, effective, but if we compare ointment with Vaseline, it's not the same. Vaseline is material close to the wax, and it's really very difficult to manage, especially when you need the larger areas on the face and the skin is sensitive. It's just very difficult to do this. And it's really very strong occlusive effect, and it's not good for the wound healing. And so that creates just impermeable barriers that prevents transepidermal water loss and to prevent the entry of water and oxygen into the skin. So we recommend ointment, which is right composition. Why? Because it's semi-occlusive and the wound can breathe. We have film still, but the wound can breathe and it's protected. We support hydration for injured area, and we overload most. Successful restoration of the skin barrier occur as well, and the proper oxygen pressure and partial occlusion of epidermal injuries result in better epidermal response and restoration. So that's why we recommend ointment, but not a Vaseline or antibiotic ointment. And I will not to talk about this a lot. Just I can just agree 100% with the doctor who really mentioned this, and it's true that we can see significant improvement in erythema, edema, and transepidermal water loss, and no different was between using antibiotic and Aquaphor after laser procedures. And it was very important as well that there was no allergic reactions and it was safe. And we know that some antibiotics are really allergic, and we sometimes don't know how our patients will react to this. And if you compare antibiotics, every kind of antibiotic, there was no statistical improvement in edema or erythema at any time of point, as you see. And as well, it was no improvement in transepidermal water loss function. But what I can say that the wonder and introducing ourselves in clinical practice with Aquaphor was the tattoo removal study what we made together with other doctors in Lithuania during the past maybe 2 years. You can see how looks the hole after the tattooing. When we do removal of the tattoo with lasers, we have already just immediately skin whitening. Then post-procedure period is really always with open wounds. And because of the high energy and very intense energy of light pulses. And the tattoo procedure usually causes significant dysfunction in the skin barrier, even 7 times higher average of transepidermal water loss. So can you imagine what happened with the skin? In one part, the tattooing do similar things, and after the laser is even more. And we can see this. But whitening and wounds, and later, of course, there is scaling and other things with skin barrier. And okay, here was like normal view of the procedure, what we are expecting. But when you see patients like this after the laser, with a big bulls, vesicles on the top, It's really, we were shocking. And I thank you, Dr. Juliana, Jolanta Juliana, for the pictures. I think in general, she is the best tattoo remover in Lithuania with lasers. You see that with a good wound, with wound, with the closing the wound, with the using of good products, you can manage this. And when we're doing study, usually you should keep protocol. And in our protocol was to use only aquaphor. And it really was like a miracle. It helps to heal with any antibiotics or with any hormonal preparation. And what was interesting as well for us that you can check this not only by your naked eye, but you can check how the tattoo goes after the laser by dermoscopic view. You just can see little holes after this, and you can see how crust makes on the top and how it heals. So I would like to say just like a resume that it's really source product for the skin care, for the wound care after the laser procedure, because it's antibiotic free, it's petrolatum-based ointment, it's not a Vaseline, also contains humectants, skin conditioner, natural burial lipids, and it really facilitates on wound healing. And it's semi-occlusive environment. And what is important as well, that it absorbs 3 times its weight, like aqueous solution. And so that's why we can put even on the oozing skin and we have a really good skin healing. And beside this, it's not comedogenic. So source product, please listen this song when we finish our webinar from our Lithuanian singer. I was amazed with my song. And thank you for your time, because I know that everybody maybe likes to have nice dinner now. Thank you, and we will be waiting for the questions.
Thank you, Ruta, a lot for your warm and very nice presentation. Yeah, as you mentioned, that it would be very nice afterward to have a great dinner together with all of us. But it will happen soon. I really hope so. So I would like as well now to give a stage to our expert speaker from Latvia, dermatologist Anna Berzina. Please, Anna.
Hi, and good evening, colleagues. And before this nice dinner that was offered to us, I have to tell you a few words about my experience with anti-pigment products. I think it's a little bit more than a year that I have recommended these products to my patients. And I have to tell that I only have the best experience and the best results from the serum and from the creams. So it was a rather easy task for me to tell you about my experience, because it's a rather long one already, and it's a good one. So a short introduction about myself. I have been working as a dermatologist for 12 years in a private clinic, and a few more during residency, of course. And I think hyperpigmentation has always been an issue for our patients, for our clients, and they usually want some very effective treatments, some options, some skincare products that they use at home as well, between the laser procedures or when we offer them IPL, the intensive pulse light therapy sessions. This is what we can offer them in the clinic. But the skincare at home, it's also of great value. So these products for reducing hyperpigmentation, I think they are the first ones that I can recommend to my clients and my patients, being 100% sure that they will work and the patients will enjoy the result. So Actually, the consultation before the recommendation of these anti-pigment products, it's essential though, because sometimes it's not only the hyperpigmentation, it's not only the brown patches that and the uneven skin tone they dislike, but sometimes there are seborrheic keratosis or actinic keratosis or other kind of dermatological diseases that you have to treat in a different way. But if it's only hyperpigmentation, if it's only brown spots, then these products do work indeed. So a great bonus to my mind is the way you can apply these products, the consistency of them, both the serum and the creams. Patients do enjoy the consistency of them. It's very easy to apply them. It takes a very short time for the products to absorb. And if you want to apply some makeup products afterwards, so it takes only a few minutes to for the serum and for the creams to dry. And actually, they work as a perfect base before the makeup. And another thing, that the scent of the products, it's also enjoyable and it's fresh. And then I think it's not less important than the other good things about these products. I have recommended these products to my patients who have different skin types, and as well as for patients with sensitive skin. So this is also an important thing for me, because I can be sure that they are okay with either it's a dry skin type, or it's a normal skin type, or it's a combination skin type, or any other. And even if for sensitive skin, I have never had a patient that had told me afterwards that there was some kind of irritation or dryness or scaling or redness or anything like that. So it's actually it's a perfect thing, because that is sometimes an issue with other products that are meant for whitening, that fight against hyperpigmentation. So with these products, there has never been an issue of this kind. So another thing, the fact that it takes such a short time to see the first results, and in this lifestyle as we have, we're always in a rush and in a hurry. We always want the products to work very quickly. We want to see the result. And even if you don't combine it with laser, actually with these products, you really can see the effect in 2 to 3 weeks sometimes. And that's a positive thing, because, yeah, as I already told, that we want to see the results now, and we don't have the time to wait for a longer time than 2 to 3 weeks sometimes. So now it maybe seems that these products are perfect, like there are no side effects and nothing like, not a thing to add. But if I had to add one thing, I think, well, SPF 50 would be the perfect thing, not as SPF 30 that it has, the day cream. So if the day cream had SPF 50, then probably I could tell that this is a perfect product. It has every feature that one could want from a product that fights against hyperpigmentation. So yeah, you usually have to remember that the sun protection is of great importance, of course. Actually, sometimes it seems unbelievable to me, but my patients and my clients, and I know that for other doctors it's the same, that our clients and patients keep attending sunbeds. Even nowadays, sometimes it's really unbelievable. But then you have to bear in mind that it's sometimes an issue as well. I have had patients that I have treated the hyperpigmentation, and then the next question is when I can start attending the sunbed again. So yeah, the sunscreens, it's to get the best result, you have to remind them that sun protecting factor, it's of great importance. And last but not least, the positive thing about anti-pigment products is the price. I think it's very important, but because sometimes those products that are fighting against hyperpigmentation, they are very expensive and causing irritation. So it's sometimes hard to recommend these products to our clients. But the anti-pigment products, their price is affordable and pleasing. So now let me show you the pictures of two of my patients who used the anti-pigment products. Just a second. So the first one, this was a patient of mine. The story, I think it was rather interesting because she came to me in the office and telling that she has her wedding day in a month. And she was not happy with her upper lip hyperpigmentation. And one reason why we didn't do the laser procedure was because of her low pain level. She was very afraid of feeling something painful during the procedure. That was one thing why we didn't do the laser. The other thing was that the time, it was the beginning of summer. And again, she had really dark those patches on the upper lip. So that was the second reason why we didn't do the laser. And but she wanted to treat her hyperpigmentation in order to have her best possible look at her wedding day. So she started using anti-pigment, the serum twice a day, and the day cream and a night cream in the evening. And then she sent me the pictures. The picture in after 2 weeks, she had used the products, and this is what I saw. And I think we both were very happy about the results. She was satisfied with the result, and makeup on her wedding day. She could apply the makeup and completely without seeing the upper lip hyperpigmentation. And the second patient, again, she was telling me that she wants to treat the upper lip hyperpigmentation. That was the only thing that was bothering her. But in my mind, she had not only the freckles and the skin type where you always get the uneven skin tone during the summer, but she had also those lentigo type hyperpigmentation all over her face. So that's why, and also we didn't do the laser procedure, and in this case it was because of the beginning of summer. And this is the picture she sent me after 3 weeks. She had used, again, 3 products of anti-pigment range, the serum twice a day and the day cream and the night cream. And here we already can see clearance of the pigments, and the skin tone is more light, it's more even, and the hyperpigmentation of the upper lip area, it's getting lighter. But she kept using the creams, and here again you can see not only the lightening of the hyperpigmentation, which was bothering her, but I also like the more light, this overall look of the skin color. So thank you for your attention, and I think now it's probably even easier for you if you haven't started to recommend these products to your clients and patients. Now probably it will seem easier for her. For you as well. So thank you.
Thank you, dear Dr. Anna, for your really good examples how we can fight with pigmentation. So thank you a lot. And I would like to give a stage for our doctor expert from Estonia, Dr. Kaisa Viljar. Please.
Thank you so much. I would firstly like to thank all the previous speakers for such lovely presentations. They were really informative, and I hope everybody learned something new. I work in Estonia in a small town called Tartu in Tartu University Hospital. I'm a dermatology resident, so therefore I definitely do not have that much experience, but I'm really humbled and pleased to give a little speech about melasma. We heard about that in the first presentation, which was amazing, but I would try to give a little insight from a different angle and speak a little more focusedly about this problem. As I am the last speaker, I would try to keep my presentation short and focused. And after a few slides, I will also present two patient stories that are connected with this topic. So why do I want to speak about melasma is that it's really common. There have been different studies in different populations, and up to 70% of the women in the reproductive age are actually affected. And not to mention that also men can have this problem. We have heard a lot about this problem being particularly present in women, but actually a smaller percentage in men also. It occurs. So this is actually more common than maybe we acknowledge. So melasma is a form of hyperpigmentation, and it presents usually as bilateral blotchy or brownish facial pigmentation. It is thought to be triggered by many things, mainly sun exposure, and not only sun, as we heard before. It's also the visible light and hormonal changes. Sorry about this this slide presentation. For some reason it goes so quickly. Anyhow, it is not only the sun or the visible light that we have to focus on. There are many other actually problems that are causing this melasma. One of those is hormonal changes. So it's not only pregnancy. When we talk about women in fertile age, it's not just the pregnancy, but it's also the hormonal contraception that we take orally, or the hormonal treatment after menopause. So this is also something we have to consider. And when we talk about the pathogenesis of the melasma and hormones, it's actually changes in estrogen and progesterone levels that increase melanin synthesis through different pathways. And estrogen in particular increases the amount of enzyme tyrosinase, which was talked about in the first presentation as well. And it also acts on the melanocortin receptors in our skin that actually make our skin cells more sensitive to the sun and visible light. Interesting fact is that the number of pregnancies increases the risk that melasma would emerge. First, during the first pregnancy, doubling and tripling for 2 and 3 or more pregnancies if we compare it to the time primigravida. So it's really important to keep in mind that not only pregnancy, but also all kinds of hormonal changes can lead to this problem. So if we want to treat the patient, the good news is that if it emerges during the pregnancy, it usually regresses within 1 year. But as with everything in medicine, we can't give guarantees that it will resolve. So areas of hyperpigmentation may never completely resolve even after the pregnancy, even after giving birth, or even after the lactation has stopped. So it is really, really important to prevent the onset of melasma by strict photoprotection. And I kindly remind you our first presentation that it's not only the UV light protection, also the visible light protection that we have to concentrate on. But as said before, people want quick fixes nowadays. Everybody wants to see the results right away. So if we think about destructive modalities, for example, cryotherapy or medium depth chemical peels, there can be unpredictable results and there can be potential adverse effects. So this is something that we have to keep in mind, that those really quick fixes are not always the best fixes. And the mainstay of the treatment remains topical depigmenting agents. So if we talk about the postpartum patients or patients that are not currently pregnant, then we can consider, of course, lasers, combined treatment, chemical peels, topical therapy. Of course, we talked about hydroquinone before, retinoids. But as we learned before, combination treatment is something that is the best way to treat melasma. We also heard a little bit about the systemic treatment with tranexamic acid. It has shown to be effective as well, but there are some thromboembolic events risk that we have to keep in mind, even regardless of a low dosage. So it really shows us that we have to really choose really carefully the patient that we are giving the systemic treatment to. And I personally wouldn't recommend giving systemic treatment with tranexamic acid to a patient that is currently pregnant. So if a patient is pregnant, what do we have to keep in mind, or how do we treat melasma in those patient groups? I'm sure most of us have heard that in the United States, the FDA has assessed the safety and usability of medications in pregnancy and lactation, and it is designated one of five letters: A, B, C, D, and X. Categories A and B are usually considered safe during pregnancy, as if category C, D, and X are generally not used in pregnancy because the potential risks to the fetus have been demonstrated in controlled studies. So to give you a small example, if we talk about the depigmenting agents that are really commonly used, for example, hydroquinone or tretinoin, these are category C substances. So these are not the best options for pregnant patients or patients who are breastfeeding at the moment. So the best way to treat those patients with melasma is photoprotection and mild topical treatments. When we talk about an amazing agent called thiamidol, which is present in these Eucerin's anti-pigment series or products, to be completely fair and to tell the truth, there are no formal studies yet on pregnant or breastfeeding patients. As far as I found out, it was one of the exclusion criteria for choosing patient groups to different studies, but nevertheless, I personally, and I believe that some of my colleagues as well, have tried those anti-pigment products on pregnant patient or breastfeeding patient groups as well. And as far as I know, I haven't heard of any side effects. So I will now present you a few cases about melasma that are connected to this topic. First of all, the local case study we conducted, the patient was a middle-aged woman, and the hyperpigmentation occurred over 10 years ago. As we speak about the middle-aged woman, it's actually understandable that she has some hormonal changes going on in her body as well, but she also had some medical issues connected to that topic, which I'm not going to discuss here more specifically, but she used Eucerin's anti-pigment corrector up to 4 times a day and sun-free pigment control, and the results occurred after 3 weeks of application, and we can see here that the border of the lesion is absolutely cleared, and the color as well has changed. This is a bit better picture of her in the natural light. I hope it shows here. Yeah, this is her. So we can see in the natural light that this is really a good progression when we talk about only 3 weeks of using. So the second one, the local case study we conducted, is a young woman whose problem with melasma started about 3 years ago. She had a history of using oral hormonal contraception for years, but the problem had really gone worse in later few months. It really presented super dark blotchy areas, and she was really disturbed by the outlook of this problem. So she started using this anti-pigment serum, day cream, and corrector, and of course the strict photoprotection. She noticed first changes already after a few weeks of using those products, and I will show you now more closer look. It's not just a beautiful young woman with pretty flowers. We can see from the next photo that she has those lesions mostly on her forehead, and it's understandable why she was really disturbed by it. So after using those products for 2 weeks, she started noticing some of the improvement, but she continues using those, and as we can see here, the problem is almost completely resolved. Of course, the photoprotection continues, and it's but I believe personally that it's really a nice result, and she is really pleased with the result herself as well. To say that no side effects were noticed, so from my really short experience as a dermatologist, I can recommend that if a person has a problem with melasma, that it's really worthwhile to give a try to this thiamidol consisting product line, because no side effects have been noticed so far, and the results speak for themselves. So this was my presentation, quick and focused. I really want to thank everyone for listening and for such a nice and informative evening. I would like to remind you that beauty is skin deep, but of course I think we can all agree that beautiful skin contributes to higher self-esteem and overall well-being. So thank you from Estonia, and have a nice evening.
Thank you a lot, Dr. Kaisa Willer, for your really deep presentation with all examples. We really appreciate it. And I think that we already, finished with all our parts. And of course, I would like to thank all the our speakers, Dr. Firas, Ruta Gancevičienė, Anna, Dr. Andra Berzina, Dr. Kaisa Willer, but we have as well questions. So I would like to invite you all, because we have for everyone and already almost 8 questions. So maybe I can start with the first one, which is addressed actually to Dr. Firas. Could we use Aquaphor also after chemical peelings?
Yes, absolutely. I mean, what we are discussing here is also applicable to chemical peeling, because the injury to the skin, whether it's post-laser or post-chemical peel, you have the exfoliation effects and removal of the epidermis and injury. And Aquaphor, I personally don't do a lot of chemical peels, but I have colleagues who use chemical peels. And in fact, a decade ago, the first time I heard about Aquaphor was in a chemical peel session in the United States. So the short answer is absolutely.
Okay, thank you a lot for your good and very deep answer. And the second question would be for Anna Berzina. How long would you suggest continuing the anti-pigment in your clinical practice?
You know, it depends on the case, because sometimes it's enough with a month or 2 months, and then the hyperpigmentation is gone. It's completely the skin tone is even and lighter, so the patient can continue with different skincare products that doesn't fight the hyperpigmentation. It really depends on the case, but I think in my practice, there has never been a case when the patient continued using the products more than 2 months. I think it's maximum.
Okay, very clear. Thank you for your answer. And the second question goes to Ruta Gancevic. Yes, Ruta, yes. Ruta, how does the paraffin liquid semi-occlusive in Aquaphor? Could you please explain on what scientific background we can say that it's different from a regular paraffin liquid?
Just because it's not only paraffin liquid and the ingredients are different, like Dr. Iris show it for us as well, very, very nicely and very clear. It's not only one ingredient, and it's several ingredients, they work together.
Good. Thank you a lot. I think it was good and answer to our doctor. And there's another one questions. I would like to ask doctor from Estonia. Dear Dr. Kaisa Viljar, our doctor is asking about how, just a second. The best approach to treat post-inflammatory acne hyperpigmentation.
I think the best way is to actually combine different treatments. I referred to our first presentation. I can't say that all the products work for all the patients. It really depends what state the post-inflammatory hyperpigmentation is and where are those lesions and how much are patients bothered by those. But I really prefer combined treatments. So it's a really individual treatment plan for each patient.
Okay, thank you a lot. Again, Dr. Firas, the question is for you. And how does bepanthen compare to Aquaphor? Very good question.
It's a very good question because bepanthen is, I hear a lot about bepanthen whenever I go to Russia or Ukraine and do a workshop. When I looked at it, if I'm correct, bepanthen is just 5% panthenol. So it is a single ingredient predominantly, which is panthenol. And don't get me wrong, panthenol is fine. It has mild anti-inflammatory effects and hydrating effect. But that's just one ingredient. So the difference between Aquaphor and bepanthen is that you have other ingredients in Aquaphor in addition to panthenol, which is bisabolol. And more importantly, as my colleague said, it's the mixture of paraffin. So I totally agree. The reason why it's different from paraffin is just not plain white or yellow paraffin. It's paraffin with the Eucerin and the microcrystallinia. And that composition, that combination and the composition is such that it's allowing for that breathable skin and semi-occlusive. So it's the way that it's manufactured. So yeah, bepanthen is basically just one of the 5 key ingredients of Aquaphor. That's all I would say.
I totally agree because yes, as you mentioned, it's like a one only ingredient. In bepanthen and Aquaphor have a totally more very good ingredient inside. And as well, the second question, Dr. Fries, as well for you.
Sure.
Can we treat patients with thyroid disease?
Yeah, of course. The answer is yes. And actually, that's a very important part because patients with underlying thyroid disease, particularly autoimmune thyroid disease, tend to have very difficult melasma. We know that melasma in patients who have autoimmune thyroid disease are going to have a very strong melasma and very, very rebound. So in the medical history sheet, I always ask about autoimmune disorders. And if they tick autoimmune thyroid disease, I always tell them that it's absolutely important that they use the topical treatments and they will use it for a long time afterwards to prevent a rebound as well. So you can treat, it's safe, but remember, if you have melasma and autoimmune thyroid disease, you have a difficult melasma.
Okay, thank you. And last question as well for you, Dr. Firas. How about tolerability of tranexaminic acid.
Are we talking about oral or topical?
I don't know. It's like,
Okay,
it's mentioned
fine.
like gastrointestinal side effects.
Yes, there are gastrointestinal side effects. That is true. Not everyone gets them, but it's gastrointestinal side effects. So I use typically the dose of 250 milligram twice a day. And I always try and tell them to have it after a meal. So after the breakfast with a full glass of water to try and minimize. And then, we have some of the antispasmodic and herbal medication. But I try and tell them to use it after the meal with a full glass of water to try and reduce the gastrointestinal symptoms. But to add to what my colleagues already said, there is enough data now that actually the true risk of thromboembolism is very, very low. And it's only in patients with a positive personal or family history of thrombofailure. So in those patients where there is no family or personal history, actually, and this is the very important part, and this is how I convince my patients, is the risk is no higher than the contraception pill. Most of my women who I see in central London will be on a contraceptive pill of one form or another. And many of them are on the combined contraceptive pill, which has estrogen. And we know that the contraceptive pill increases the risk of thrombophilies. We know that. This is why we give them the advice not to smoke, and if there is a stroke history or a pulmonary embolism. The risk in patients with no personal family history, when you look at all the data and the studies from the meta-analysis, is not higher. It's the same. So I tell women, look, if you're going to have the contraceptive pill, it's the same level of fear to oral tranexamic acid. And this is not me saying that. That is the extract from the large studies and data that is available now. In terms of one other point, in terms of pregnancy, now maybe you will be able to aid me, but my understanding is that Beiersdorf have cleared thiamidol to be used during pregnancy in terms of safety. Am I correct?
Yes.
Yeah.
Okay. You are correct.
Yeah. So I think that's a new thing. I also, like my colleague from Estonia, I until recently thought that wasn't the case, but I think very new data from Beiersdorf has now cleared it during pregnancy.
Okay. So as I see that all questions are already answered. And I think it was really interesting to have them from our participants. It means that they were really listening and engaged. And those 2 hours we spent really, in this unfortunately online atmosphere, but I really hope that in the nearest future we will saw each other, and as Ruta mentioned, that we will have really good dinner together. So I would like to thank you, all of you, dear speakers, Dr. Firas, Dr. Anna, Dr. Ruta, Dr. Kaisa, for all your support, for all your really good presentation, deep presentation about and to share your knowledge and practice, and as well, to be together with Eucerin. So many, many thanks for you. And I would like to say for all participants that we will send you, who was connecting by emails, a short survey just to understand how this training conference was for you, what we need to improve and what you like. So be kind to ask them. It's very important for us to improve ourselves. So big thanks to be with us during those 2 hours. We really appreciate it, and keep in touch and be safe and healthy. Bye.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye.